Picture this. You're sitting in a dentist's chair, but there's no gentle hum of modern equipment, no numbing gel, no reassuring you'll just feel a little pinch. Instead, there's a Roman physician approaching you with bronze forceps, a red-hot cauterizing iron, and the absolute conviction that your toothache is caused by an invisible worm eating your tooth from the inside. Welcome to ancient Roman dentistry, where the cure was often worse than the disease, and where dental hygiene involved ingredients that would make a medieval witch blush. You think your dentist is expensive? These guys charge you your dignity, your comfort, and occasionally your consciousness. Spoiler alert, nobody left these appointments with a smile. Let's start with the foundation of Roman dental philosophy, the dreaded tooth worm. Imagine explaining to your boss that you can't come to work because there's literally a worm living in your molar, eating it from the inside like some microscopic Pac-Man. That was Tuesday in ancient Rome. This wasn't just Roman thinking. Civilizations across the ancient world bought into this theory harder than people buy into cryptocurrency today. The logic seemed sound enough. Something's causing pain inside your tooth. It must be alive, therefore it's probably a worm. Case closed, mystery solved, time for lunch. Pliny the Elder, Rome's answer to Wikipedia, but with significantly less fact-checking, documented dozens of remedies for expelling these mythical creatures. His natural history reads like a cookbook written by someone who'd never seen food before. Burned mouse ashes mixed with honey? Sure, sparrow droppings wrapped in wool? Why not? Snake skin soaked in oil? Absolutely. The real kicker? Sometimes you didn't even put the remedy in your mouth. Pliny recommended applying certain concoctions directly to your ear because apparently toothworms were excellent at hide and seek. It's like trying to fix your car by pouring oil in the gas tank. But here's where it gets really wild. Pliny also suggested drinking wine sweetened with lead. Yes, lead. The same Pliny who was dispensing dental advice was also advocating for slow-motion poisoning. This is like getting nutritional guidance from someone who thinks pizza is a vegetable. The Romans took this stuff seriously, dead seriously, literally dead in some cases, because following Pliny's advice was roughly equivalent to playing Russian roulette with your digestive system. You have to admire the confidence, though. These people built roads that lasted millennia, engineered aqueducts that still inspire modern architects, and conquered most of the known world. But faced with a toothache, their solution was, let's try mouse ashes. It's like being a rocket scientist who fixes computers by hitting them with a hammer. Now let's talk about the tools of the trade. Roman dental instruments looked like they were designed by someone who'd seen medical equipment from a distance, squinted really hard, and then tried to recreate them using only bronze and pure intimidation. The risagra was their version of modern forceps, except imagine forceps designed by someone who thought subtlety was a weakness. These bronze beauties were built for extraction, emphasis on the action part. No gentle wiggling here. You grabbed, you pulled, you hoped for the best. Then there was the spicillum, a probe that doubled as both diagnostic tool and potential weapon. Roman dentists used these to poke around infected areas with all the delicacy of a Roman legion approaching a barbarian village. Precision was optional, determination was everything. The real star of the show was the cauterizing iron. This wasn't just a tool, it was a statement. After extracting a tooth, Roman dentists would heat up a piece of metal until it glowed like a tiny sun, then press it directly onto the open wound. The theory was that this would seal the wound and prevent infection. The reality was that this was essentially medieval electroshock therapy for your gums. Anesthesia during these procedures consisted of either wine, lots of wine, or if you were really lucky, a bit of opium. Most Romans got the wine option, which is like performing surgery with nothing but liquid courage and good intentions. It's the medical equivalent of trying to land a plane while drunk. The sterilization process was equally sophisticated. They'd wave the instruments over a flame and call it a day. Sometimes they'd splash some wine on them, which technically counts as disinfection if you're being extremely generous with your definitions. Post-operative care involved slathering honey on everything. Honey was the Roman answer to Neosporin, Band-Aids, and bedside manner, all rolled into one sticky package. Sweet? Yes. Effective? Surprisingly, also yes. Dignified? Absolutely not. Picture this. You've just had a tooth yanked out with bronze pliers, your gum has been branded like cattle, and now you're sitting there with honey dripping down your chin like the world's most traumatic breakfast. And somehow this was considered cutting-edge medicine. You think whitening toothpaste is expensive? Romans achieved their Hollywood smiles using a special imported ingredient, Portuguese urine. Yes, urine. Specifically human urine from Lusitania, which apparently had premium properties that regular local pee just couldn't match. This wasn't some fringe practice performed by dental weirdos in back alleys. This was mainstream oral hygiene recommended by respected physicians and used by fashionable Romans who wanted that perfect smile. It's like if tomorrow celebrities started endorsing mouthwash made from recycled bathwater. The chemistry actually works. Urine contains ammonia, which is genuinely effective at whitening teeth. But knowing that your pearly whites came courtesy of someone else's bladder takes some of the glamour out of your smile. It's like having a beautiful garden and finding out it's fertilized with, well, actually, that's exactly what it is. Roman toothpaste recipes read like the ingredients list for a medieval curse. Powdered deer antler, mastic resin, ammoniac salt, and goat milk, all ground together into a paste that promised dental perfection, but delivered something closer to controlled chemical warfare in your mouth. They cleaned their teeth using dentiscalpia, basically ancient toothpicks, but more exotic. The wealthy used gold ones because even dental tools were a status symbol. Middle-class Romans made do with lentisk wood while the truly adventurous used porcupine quills. Pliny claimed that porcupine quills would strengthen your teeth. He also insisted that vulture feathers would freshen your breath. Someone clearly needed to tell Pliny that correlation doesn't equal causation, and that maybe, just maybe, not everything animals produce is automatically beneficial for human consumption. The Romans also chewed mastic, a tree resin that served as ancient chewing gum. Unlike modern gum, mastic was supposed to have medicinal properties. Unlike modern gum, it probably tasted like you were chewing on a Christmas tree. Imagine explaining Roman oral hygiene to a modern dentist. Well, doctor, I brush with urine-based paste, floss with gold wire, and freshen my breath with bird feathers. They'd either call security or submit your case to a medical journal. When Romans lost teeth, whether through accident, disease, or poorly executed dental procedures, they had options. Not good options, mind you, but options nonetheless. Think of it as the ancient equivalent of shopping at a dental thrift store. The most sophisticated solution involved dental bridges made from human or animal teeth, held in place with gold wire. This technology was borrowed from the Etruscans, who apparently figured out dental engineering before Rome figured out dental medicine. It's like learning to build cars before learning to change the oil. These weren't necessarily fresh teeth either. Roman law specifically prohibited removing gold from corpses before burial, which tells you everything you need to know about where these dental prosthetics were coming from. Someone's departed grandfather might end up giving you a winning smile. The installation process was exactly as pleasant as it sounds. Celsus, a Roman medical writer, described using gold or silk threads to attach loose teeth to the gums. Essentially, you were getting your mouth rewired by someone whose surgical training consisted of watch this guy do it once, then wing it. Quality control was non-existent. There were no dental labs, no custom fittings, no follow-up appointments. You got a tooth-shaped object wedged into your mouth with some wire and hoped for the best. It's like getting a haircut from someone who's only heard haircuts described in a letter. The wealthy could afford human teeth and gold fixtures. The middle class made do with animal teeth, usually from sheep or cows, because apparently Romans thought dental compatibility was more about size than species. Nothing says sophisticated smile like sheep teeth held in place with copper wire. These prosthetics weren't just functional, they were fashion statements. Having gold wire visible in your mouth was a sign of wealth and status. It was like wearing expensive jewelry, except the jewelry was holding dead things in your mouth. The durability of these contraptions was questionable at best. Roman dinner parties must have been minefields of social anxiety. One wrong bite of hard bread and your neighbor's grandfather's molar might end up in the wine cup. Roman tooth extraction wasn't a medical procedure. It was a gladiatorial event where you were both the gladiator and the lion. The process began with the dentist making an incision in your gum using a sharp blade, because apparently Romans believed in making bad situations worse as efficiently as possible. Next came the actual extraction using Bureau bronze forceps that looked like something a blacksmith would use to remove horseshoes. The technique was straightforward: grab the tooth, pull straight up, and pray to whatever gods were listening that you didn't take half the jawbone with you. The dentist's goal was to extract the tooth vertically, minimizing bone damage. This was like trying to remove a cork from a wine bottle using only brute force and optimism. Sometimes it worked. Sometimes you ended up with cork bits floating in your wine. Except in this case, the cork bits were pieces of your jaw. Immediately after extraction, the dentist would cauterize the wound with a red-hot iron. This served multiple purposes. It stopped bleeding, prevented infection, and gave you something to focus on besides the fact that someone had just yanked a body part out of your skull with pliers. Pain management during this process was primitive at best. A cup of wine if you were lucky, a leather strap to bite down on if you weren't. Some patients got opium, but opium was expensive, and Romans were practical. Most people got the bite this stick and think happy thoughts treatment plan. Post-extraction care involved packing the wound with honey and giving you a cup of hydromel honey wine that was supposed to prevent infection and help with pain. Essentially, your post-operative recovery plan was get drunk on bee products and hope for the best. Many patients fainted during the procedure, which was probably a mercy. Fainting was the body's natural anesthesia system, and sometimes natural anesthesia was the best you were going to get. Recovery times were unpredictable. Some people healed quickly, others developed serious infections, and some never quite recovered from the trauma. Roman dental records were probably just lists of patient survived or patient didn't survive, with very little middle ground. Here's where the story gets really interesting. Despite having dental care that resembled medieval torture, many Romans actually had pretty good teeth. Archaeological evidence from Pompeii and Herculaneum shows surprisingly low rates of tooth decay among the general population. This wasn't because of their dental hygiene practices, it was despite them. Romans had three major advantages over modern people: no refined sugar, fluoride-rich water from volcanic sources, and a diet that was accidentally healthier than anything we eat today. The absence of processed sugar meant that Roman teeth weren't under constant bacterial assault. Their sweetener of choice was honey, which, while still sugar, doesn't stick to teeth the way modern candy does. It's like the difference between being attacked by one angry bee versus an entire swarm. The volcanic soil around many Roman cities naturally enriched the water supply with fluoride, giving Romans the benefits of fluoridated water centuries before modern dentistry figured out the connection. They were accidentally preventing cavities while simultaneously practicing dental procedures that would traumatize a modern patient. However, Romans did have serious problems with tartar buildup. Archaeological evidence suggests that up to 80% of Romans had significant tartar deposits, which makes sense when you consider their cleaning tools and techniques. Scraping your teeth with porcupine quills isn't exactly precision tartar removal. Dental abscesses were also common, affecting about 26% of the population. These painful infections were often the reason people ended up in the dentist's chair in the first place, leading to the extraction procedures we've already discussed. The wealthy Romans, who could afford elaborate dental work, often ended up with worse teeth than the poor who couldn't afford treatment. It's like having access to luxury healthcare that's actually more dangerous than no healthcare at all. Social status played a huge role in dental health, but not in the way you'd expect. Rich Romans ate more honey, drank more wine, and could afford more elaborate and more dangerous dental procedures. Poor Romans ate simpler food, drank water, and only saw a dentist in absolute emergencies. Roman society was obsessed with appearance, and teeth were no exception. A good smile was a sign of wealth, health, and social status. which explains why wealthy Romans were willing to undergo such elaborate and painful procedures to maintain their dental appearance. Slaves and lower-class citizens generally had healthier teeth than their wealthy masters, purely because they couldn't afford to ruin them with expensive treatments. It's the ancient equivalent of not being able to afford cosmetic surgery, then accidentally being healthier because of it. The Roman elite competed over who had the most elaborate dental work. Gold dental bridges were like ancient grills. The more gold you had in your mouth, the higher your social status. Except Roman dental gold was functional rather than decorative, which somehow makes it both more practical and more disturbing. Dental problems could seriously impact your social standing. Missing front teeth affected your ability to speak clearly, which was crucial for anyone involved in politics or public speaking. In a society where oratory skills determined political success, dental health was literally a career requirement. Women faced additional pressure to maintain dental beauty standards. Roman poetry frequently praised white teeth and fresh breath, creating beauty standards that were difficult to achieve and expensive to maintain. It's like modern beauty standards, but with more risk of actual death. The dental profession itself was somewhat looked down upon, despite its necessity. Dental work was often performed by general physicians rather than specialists, and it was considered one of the less prestigious medical practices. Even the people performing these procedures knew they were basically professional torturers. Roman dinner parties became elaborate social performances where dental work was both displayed and tested. Eating in public was risky when your dental bridges might not survive the evening's entertainment. Roman dentistry represents everything fascinating and terrifying about ancient medicine. Impressive innovation combined with complete ignorance, sophisticated engineering mixed with superstitious nonsense, and the kind of confidence that could only come from having no idea what you were actually doing. These were people who built the Pantheon, engineered the Colosseum, and created legal systems we still use today. But when faced with a toothache, their solution involved mouse ashes and porcupine quills. It's like being a rocket scientist who fixes computers by hitting them with increasingly expensive hammers. The Romans gave us roads, aqueducts, concrete, and the concept of civil engineering. They also gave us dental procedures that would be considered torture by today's standards. They were simultaneously the most advanced in the civilization on Earth and completely clueless about basic medical hygiene. What's really remarkable is that they survived any of this. Roman dental patients were essentially volunteering for medieval torture in exchange for the possibility of maybe fixing their tooth problem. The fact that anyone voluntarily underwent these procedures suggests that dental pain in ancient Rome was genuinely unbearable. Modern dentistry owes nothing to Roman techniques and everything to the human capacity to learn from absolutely terrible mistakes. Every advancement in dental care represents humanity collectively deciding, let's never do that again, to something Romans did regularly. The next time you're sitting in a modern dental chair waiting for your routine cleaning, remember this: you're not just getting your teeth cleaned. You're participating in the greatest improvement in human comfort in the last 2,000 years. When that dentist approaches with modern tools, anesthesia, and actual medical training, you're experiencing luxury that Roman emperors couldn't have imagined. Caesar conquered Gaul, but he couldn't conquer tooth pain without risking his life. So smile. Flash those teeth that were cleaned with fluoride toothpaste instead of Portuguese urine. Appreciate that your dental bridges weren't salvaged from graveyards and that your dentist learned their trade from textbooks instead of trial and error. You've survived Roman dentistry by having the incredible good fortune of being born 2 millennia too late to experience it. And honestly, that might be the greatest victory in human history.